With Americans living longer, many of us as adult children are seeing a reversal in our roles. We've now become the caregivers for our aging parents. This can be a difficult and challenging transition, but on today's Health Talk, we're going to share some helpful tips that may make our lives easier. My guest is a family physician and geriatrician. She'll provide some important advice on how to manage these complex, changing roles. So please stay tuned. We're up next. Hello, I'm Dr. Eric Mazer. Today we'll discuss the changing roles of adult children with Dr. Amber Brody. Dr. Brody's a family physician and she's a geriatrician with Wilton Primary and Specialty Care. Amber, it's so good to have you back on the show.
Thanks for having me again. It's a pleasure to be here as always. Thank you.
Well, this is a topic that's dear to my heart.
Mine too, yeah, absolutely.
And it's just, and I'm on the caregiving side at this point, but probably not too far away from the care recipient side.
No, knock on wood.
Hopefully.
Yeah.
But this is something that we have aging parents, and it's very difficult. They lose cognitive and physical skills. If we're lucky enough to have them that long.
Absolutely.
And many of them, so many of them need care. And it's hard emotionally. COVID has added to the complexity.
Absolutely, yes.
Again, our own story is my mother-in-law is 98 years old. She is she was independent until her early 90s, broke her hip. This typical story.
Yes.
Lost mobility, but also she had surgery to fix the hip.
Yes.
And mentally, she lost considerable amount post-operative, to which I learned is not uncommon.
Absolutely.
She now requires nursing care, full-time nursing care.
Yes.
And to exacerbate things with COVID, we can't see her.
Absolutely.
We were visiting her outside briefly during the summer. So this is very hard on my wife. This is, I'm sure, very hard on her because she really has no one else.
Yeah.
So and you feel guilty, you feel sad, you feel torn.
It's one of the non-joys of aging. There are so many joys of aging, but then towards the end.
Oh, I'll have to get those from you after.
Yes, yeah, okay. I'll provide you a list. I'll pull it out of my back pocket. So yeah, you brought up a lot of good points there in regards to the caregiver role and its switching and the different stages of aging and the stages of life. And it's sort of like being a baby again, except you are in your 70s, your 80s, your 90s, or you could be even younger. Certain things happen to certain people earlier. And it's a difficult thing for the families and God willing that you have a family that can take care of you. So it's difficult, and people need to know to reach out for help because there is help out there. As you know, we have home care agencies, we have hospice agencies, and there's teams that work together to help support the family or whoever that caregiver is. It could be a neighbor, it could be a niece, it could be a grandchild, obviously, it could be a son, a daughter-in-law. There are so many people, and they don't realize that they could soon be in that caregiver role. It could happen overnight.
Absolutely.
And so it's important for us to be educated in what's out there to support us.
And I guess is that the first, or I should make this declarative, that's really the first important point, is that there is a lot of help out there.
Yes, absolutely.
And to avail yourself of that help. I know a lot of people feel guilty too. You feel like, well, my mother was there for me. I want to do everything there for my mother. But on the other hand, I've got a family on this side that I have to take care of.
Absolutely.
Or even if you're older than that, I have a life. People, how do you balance?
I've heard the term sandwich generation. So people are living longer. And so there is a generation out there now that's sandwiched, as you mentioned, between their life, their family, their children, and their parents, or their aunts, or their grandparents. So it is very difficult to balance what's necessary to care for these individuals who are in need. And there are ways that you can, there's care.com, I'm sure we've seen online websites, so you can pay out of pocket to have someone insert themselves into that caregiver role. or you too can try your best to do it, but it's a balance. So I see some of my patients, they have moved in with their families during this time and sold the house, but these are individuals who are going to work all day, but then they're up all night because mom has dementia and mom is up all night. So they're getting no sleep, so then they get sick, and it's a very difficult place to be. So people need to know to reach out for help and to put themselves in the right healthy place for themselves in order to care for that person who needs that attention. And people need to ask for help when they need it.
Yeah.
And that's what I see a lot of people coming to me. Not only do I take care of their parents, but then they come to me as patients, and they're stressed out, and they're exhausted, and they're having illnesses because of what they're going through trying to balance life and caregiver role. And you need a lot of support when that finds you. So it's important to reach out for help. And obviously, primary care doctors are a good place to start. We have social workers who are the workers for our society. Mm-hmm. So they're there to be on the case to help out in order to put the building blocks in place to have you set up for success. And it's a very important thing to realize that hospice is a wonderful benefit to everyone who's on Medicare, 65 and up, and you can graduate from hospice. It doesn't mean it's the end, it's just that extra help that you need.
Do they still require a physician to estimate a 6-month survival?
A 6-month, yes, absolutely. There needs to be an estimated end-stage illness or end-stage dementia that leads to what's estimated to be 6-month survival in order to qualify for hospice.
The other thing that surprised me about hospice recently is that there's less use of the inpatient hospice that I saw. Yes. You really needed to have a specific requirement for that inpatient service, as opposed to my dad used hospice when he was, that was 20 years ago.
Okay.
But he just, well, at that point he did need that, but you could just go in there with that estimated survival and the need for a lot of services.
Correct. And they're called inpatient palliative units, IPUs. These do exist. They also call them hospice floors, where that's all, every patient in there is very close to end of life, but needs that extra 24/7 care because they're that close. That can either be done on a hospice floor or at home. The caregivers are trained to use the hospice kit. But I think it's important to have the ducks in a row, per se, prior to getting to that end point, because we need to make people comfortable.
And I think, again, I always worry about the caregiver who feels guilty, at least I'm sort of projecting myself. But
I see it
you
often,
feel guilty not giving everything to everybody.
Right.
And yet when you try to do that, you can literally destroy yourself and make yourself less effective in the process of trying to be the parent, be the husband or the wife, be the daughter or the son.
It's very difficult.
I know it often falls on women more than men, but I'll say...
I was going to bring that up, yes.
But I will say, not always.
Not always.
I've lived the other side of that.
Yes.
And it's circumstance. You know, I happen to live closer to my mother and father than my sisters did. So it's a different dynamic.
Absolutely. And you see it as well when you... when it comes to location, things can precipitously change for an elderly person if they're taken out of their home, say, to move closer to another family member in order someone was available to care for them. They often decline because they're not at home, they get confused, it ended up being not the best thing to move them. So I see that. So it's usually best to keep somebody home if you can and have them cared for there. But if they need to move in with you, that's great, but expect a difficult transition period, and that's normal as well.
How about the struggle between, should I send my mother to a nursing home or should I have her live at my house?
Right.
Do I feel guilty if I send her to a nursing home?
That's an excellent question. And being the director of a nursing home myself, I would say that we take excellent care of the people there. We are in that field of medicine because we love to care for these people. And we enjoy being with them And people who are in a nursing home, be it long-term care or short-term or respite care, I'm not sure if you know what respite is. It's
Tell the folks at home.
Yeah, it's a Medicare paid benefit that allows the caregiver to have a respite time from that individual who they've been caring for. And it's a 2 weeks covered. The patient is taken to a nursing facility, given that 24/7 care so that the caregiver has 2 weeks of a break, of a vacation, of a respite.
Again, I just want to emphasize the point that the caregiver has a right to a life themselves.
Amen.
They have to, you have to find the life for you and your family, what makes you happy, in addition to the obligation for caring for the ones you love.
Absolutely.
And that's where you have to reach out.
Yeah, sometimes patients and people are safer and better cared for in a nursing facility where there is 24/7 care, where if they need to have one bag of IV fluids, we have it, no problem. When they need to be, say, closer to a hospital, if necessary, most nursing facilities, ironically, are very close to other care if necessary.
We found also with mobility issues,
Yes.
when someone has severely restricted mobility, yet they still are trying to get, the risk of fall at home would be
precipitous.
Terrible.
Right.
You get that in a nursing home, but they have special ways to reduce that risk. Can't say they can't eliminate it.
Correct.
Very good nursing homes have patients fall, and I don't want in any.
Yes, and it's usually a slide out of a chair of sorts, 9 times out of 10, or a fall out of the bed. But a hospital bed is usually kept close to the ground where there are mats if necessary. We have Hoyer lifts in order to help us transfer patients. They get their baths. And
so we're running out of time. As people enter this, or people that are in the middle of this, what should who are saying, I'm ready to pull my hair out, I've had it, I feel guilty, I feel inadequate, I feel sad, I'm not the husband or wife, I'm not the mother. What should their first step be?
Reach out for help, be it your primary care doctor, your therapist, social workers in the community.
And you said therapy. There's such a stigma, still a stigma, I think, with mental health.
Oh my gosh, we could talk about that another day, but
people,
yes.
Yeah, people, it's not bad to be sick.
Yeah, you have to remember that we are made of mind and body, and we are so good at taking blood pressures and temperatures and counting respirations. But you can't take a thermometer and take a temperature on someone's mental health. And that's part of health as well. And
there really is it really is help out there for those who are stressed, who are depressed, and it can be pretty dramatic.
You have to, I tell my patients, live your best life. And if living your best life involves you having a therapist or taking a medication to help you with your mental health, what's wrong with that?
Weak.
That's a great thing.
You're not any weaker than because you have high blood pressure.
Yeah, exactly.
Well, that's really such important information. Don't try to do it alone. Get help. Go through your primary care physician. They can refer you to a whole host of
people. And don't feel guilty for taking care of yourself as well.
I think in the COVID era, too, we have 211 for help. Isn't that?
I think so. Is it 411? No.
Maybe 411. But there is a number
to reach out.
That people can reach out and get help. And Amber, this is such a good conversation. I could go on for this forever.
I know, right?
It's one of those areas that we overlook, and everybody handles it poorly.
Yeah,
thank you, Amber.
Unfortunately.
Unfortunately, we have run out of time. I want to thank my guest, Dr. Amber Brody, for joining me on Health Talk today and discussing this very important, very timely topic. And thank you for watching. Please share your questions and concerns with us at healthtalk@nuvancehealth.org. We'd love to hear from you. We'll see you next week on Health Talk. Bye-bye.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100.
and I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself. I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
Exercise helps to improve your sleep, reduce stress, and decrease your blood pressure. But that's not all. There are so many benefits additionally to exercise. Our guest on this week's Health Talk will elaborate on the many benefits of exercise for all of us. So stay tuned for Health Talk. We're coming up next. Hello, I'm Dr. Eric Baser. Today we're going to discuss the benefits of exercise. My guest is Dr. Amber Brody. She's a family medicine physician with Wilton Primary and Specialty Care. Amber, it's so good to have you on the show.
Thank you for having me. It's a pleasure to be here.
We're going to talk about a topic that we talk about a lot,
Yes.
but we can never talk about too much.
Correct. Or do too much of, I guess.
Or
most
do
of the
too much
time.
of.
Yeah.
Exercise. It's kind of interesting because this really is, I'm old enough to remember that girls didn't exercise back when I was young.
I hear you on that. Yes.
And the girl sports were very limited.
Yes.
And now we're hearing more and more about
Yes,
the benefits of
absolutely.
exercise for all of us throughout our lives.
We're starting young. I do recall there was the Presidential Physical Fitness Awards
Yeah,
that you
I'd
got.
forgotten about that.
Yes, in elementary school. I have a few of the badges still if I look for them. There was obviously a push for being healthier. We started to see that we were dying of heart attacks and strokes, and oh, cholesterol is an issue. Oh, we shouldn't be smoking. Oh, maybe we should get up and work our heart out. And there was a shift. If you look back when I believe it was the Senate met and said we cannot continue to not label our foods and show you how much fat is in here, how much cholesterol is in here, how much carbohydrates is in here. So there was a push for knowledge, and then there was a push for overall health. And we've seen that exercise and the companies that build the equipment, they have escalated through the roof. It's so popular now. And why? Why is it so popular? Because it's good for our health.
And it actually makes you feel good.
And it gives you those happy endorphins, those happy juices.
It's really, because again, my career looking back, I remember very distinctly, this is in the early 70s, as an intern and a resident, actually the mid-70s as an intern and resident, seeing young women in their 30s coming in with myocardial infarction.
Yeah.
Young men, commonly in their 40s and 50s with heart attacks.
Yeah.
And we just don't see that anymore. I think
Absolutely.
a lot of this is due to smoking,
Yes.
which we have cut down on.
Absolutely.
And I think a lot of it has to do with cholesterol control, which
Yes.
is diet as well as medicines.
Yes.
And I contribute and exercise.
Yes.
Because there's so many more people who exercise now.
It's a great thing. I mean, I think we're doing a pretty good job. I know all of us think to ourselves, I could do a little better. But overall, I think just the societal knowledge that this is something that should be an essential part of your daily life, to get up and do something or exert yourself for X amount of minutes, be it weightlifting, cardio. There's so many benefits. And not only for our health, but our mental well-being. A big one, if you ask me, is also bone health. So it's
Maybe we could just
interesting.
elaborate on that just for a couple of seconds. 'Cause
Yeah.
you say bone health, what does that have to do with exercise?
Right. So it's very simple, actually, when I discuss this with patients, that our bones need to be stressed similar to the skeletal muscles of our body. So if you exercise and do your push-ups and work on your biceps and your core strength, that is a stressor against the muscle, and the muscle will grow and become stronger. It's the same thing. You have to put a sort of stressor on the bones to let them grow and be healthy.
If known, when they take astronauts and put them in a weightless condition,
Correct.
very quickly they lose bone mass.
You will lose bone mass, absolutely.
And a lot of the exercise they do in space is trying
Yes,
to maintain
yes.
that bone mass.
You've seen it on TV, right? They're on the treadmill. I think they're Velcroed in.
But I don't remember, it was something like 20% of their bone mass
in a small amount of time.
in a very short time.
Yes.
So that we need, bones get stronger with stress.
Yes, with weight-bearing exercise.
So
That's the key.
that's lifting weights, it's walking, it's being
It's
up.
carrying your groceries, it's carrying your kids,
Exactly.
all those things.
So yeah, and it's really been interesting to see this evolution from actually almost nobody exercised just to people did weightlifting when I was young too. To look good.
Right.
But women really have picked it up as much more aggressively than men. or
Yeah,
as aggressively as
absolutely.
men.
Yes, and you see it. I could name countless famous exercise gurus out there, be it male and female, that people have picked up on, and they look to not only for exercise knowledge, but also just input on how to live a healthy, happy, and emotionally stable life. And people depend on them. And it's important to have someone to look at in your life, even if it's, I'm admitted a Pelotoner. So is my husband, who's on it every day. And we look to our favorite instructors on there to guide us to better health. And we look forward to seeing them. We've never met them, but we feel like we know them. And that's important, especially in times of COVID. People are finding it more difficult.
So you mentioned cardio, you mentioned weightlifting, we mentioned endurance. There are all sorts of different kind of exercise.
Yes.
Tell us a little bit about for a couch potato who says it's time. I don't know what finally triggers it. Maybe I don't even want to guess.
Yeah, I've seen a few interesting triggers, and they're unfortunate consequences.
Oftentimes it is a life event, a
Right.
medical issue, a highly
family,
personal issue.
Yeah.
But it triggered you find it, or you have the. How do you get going? How do you?
Good question. And I see this in my patients quite often. How do you get going? So if you say Monday, Wednesday, Friday, get up, take a 2-minute jog. It might seem like the longest 2 minutes of your life, but then the following week you'll make it to 5 minutes per jog. Maybe you'll make it to 10. Next thing you know, I know it sounds crazy, but you'll be running a marathon. You have to start somewhere and go from there.
Yeah, I was reading, actually, the New York Times had an article on this within the past day or two, and they said start small. Start something that is easy to do, where there's not a lot of resistance to do it. They even suggested, for example, if you want to do this first thing in the morning, wear some of your exercise clothes to bed at night. You know, maybe clean gym shorts rather than pajamas.
Even just wearing those clothes and putting on a pair of sneakers makes you feel good. Even if you didn't get up and burn 1 calorie, just put those clothes on, put those sneakers on, see how you feel. It feels great.
But if you say, I'm going to get out there, and you work yourself out for 2 hours, and for 3 days you can't move and you're in terrible pain.
Don't overdo it.
You're not going to do it.
Exactly.
It's got to be gradual.
You have to find a happy medium and the proper way to do it.
And there's a lot actually being written on intensity, you know, these brief interval of intensity training versus
HIIT training,
sustained training versus weightlifting. How does one decide what to do?
Excellent question. And everybody is kind of built differently, right? So there's the thought of the fast twitch muscle and the slow twitch muscle, and some people have more of one and less of the other, and vice versa. So you yourself can either be an excellent marathon runner or an excellent sprinter, or a little bit of both, but you have to figure out what's best for you, and honestly, it's usually genetic. So look at what your parents were good at, perhaps, or even your children. What are they good at? Because you're probably good at it too.
Yeah, again, I think there are some people who tend to gain weight more easily than others.
Yes.
But you got to work at it, that's all.
Exactly. And I have dear friends who they're just built the way they're built, but they can run circles around me. And they can run marathons around me.
Yeah,
And it's not what you look like.
I think that's an important point.
How you do it, yeah.
That you can have a few pounds to shed and still be in good shape.
Absolutely. It's healthy on the inside. I see it. I can have patients come in and yes, their BMI tells me they're overweight, but their blood pressure is perfect, their cholesterol panel is incredible, and their resting pulse is low. It's because they exercise, they take good care of themselves.
The other thing that comes up is the relationship between exercise and weight, which I think is sort of overstated. I have my own beliefs about that. But in the studies, they show that exercise is really not a major component of weight loss.
Right, absolutely. And you have a certain control over a certain amount, right? A certain amount of pounds, but your genetics, unfortunately, I tell my patients this, you can't run from your genetics. So as a matter of how hard you try. Yes.
But I will say this, I have cycled over in my adult life 60 pounds up and down.
Okay.
I'm on the wrong side now, but I've got another cycle down.
Okay, all right,
future.
there we go.
But during the successful cycles down, I found that exercise does a couple things. First of all, if you're invested enough to keep up the exercise, it helps you commit to the calorie control on the other side.
Right.
So psychologically, if I'm not exercising and I haven't invested in that, I can put off investing in the calorie.
Exactly.
And the other thing about exercise, I think that is understated, is that the difference between being thin or chubby is a few hundred calories a day. We're not talking about, I don't eat 5,500 calories a day and you don't eat 600 a day.
No.
But my size, I probably have about a 2,000 calorie need. If I exercise and use up 300 calories a day, and I eat 1,900 calories a day, I'm going to be deficit 400 calories that day.
Right.
And that's for 10 days, 8 days, that's a pound.
Exactly.
So if you can maintain that exercise
and eating healthy
and keep control but not starving yourself, I think that's the right balance to both lose weight and gain weight. Not to say I have proven that does not work all the time, but it does work.
Right.
And again, people go and say, I'm going to start that, I'm not going to eat over 800 calories today. You're not going to sustain that.
It's not sustainable. These per se crash diets, they crash. So there has to be a happy medium.
Now let me ask you too, we've got a minute left, but there's been a lot written lately about short periods of intense exercise, even just a few seconds of intense exercise.
Yeah, absolutely, HIIT training.
What's your feeling about that? Where are we going with that? That's a little bit new.
I think it's a great thing. I do it myself on my Peloton. And what it does is
You're not a spokesman for Peloton.
I'm not a spokesman for Peloton. I do it on my cycle bike. And the idea is to increase that amount of fast twitch muscles. You can change the composition, actually, of your muscles based on what you work out and what you don't work out. So the idea of the HIIT training, high intensity interval training, right? It's interval. So even if it's for a few short bursts, even if it's just throwing, say, the treadmill up to, oh God, I don't know. I used to throw it up to 15 miles an hour. No, could I get that fast?
No, you can't run 15 miles
I don't think
an
I can run that fast. Shows you how long I haven't been on a treadmill in a while. Yeah, but you can just put yourself over the edge for just a few seconds, get that heart rate up, and that's the cardio training, right? The more you do it, the stronger your heart is. That's what you need.
I found that really interesting. So running up the stairs to your office might be a very effective way to get one of those brief bursts.
Yes, get those
without
small bursts
necessarily having to invest the time in.
Exactly.
And unfortunately, we run out of time.
Again.
I want to thank my guest, Dr. Amber Brody, for joining me on Health Talk today. And I want to thank you for watching. This is really an important topic. Please share your questions and comments with us at healthtalk@newvancehealth.org. If there are topics you want to see, let us know. We'd love to hear from you. Bye-bye.